Hey guys, thanks for joining us. We're going to talk about knee pain today, but before we do, I wanted to just give you a little heads up on some fun we've been having here in the office. If you don't already know, we've been having what's called a Here's Your Sign contest. So we've had almost 70 entries, and we've narrowed it down to our top 8 that we think were pretty clever, and those are up for voting, and the winner of that vote will win an Amazon Echo Dot. So go to our Facebook post with that, and then choose either 1, 2, 3, 4, all the way through 8, whatever your favorite entry was, and again that person will win an Amazon Echo Dot. So enough with that. Let's get to the meat and potatoes of why we're here today. Knee pain. So the most common form of knee pain is what we call patellofemoral pain syndrome. Basically, your patella and your femur cause some sort of what they call a patellofemoral pain syndrome. And the research nowadays, recently is showing that a lot of times the action is not at the knee itself. It's actually above and below. So if we're not assessing the hip or the ankle and feet, we're basically missing what could be happening. So for instance, let's talk about the hip right now. I want to talk about a really important muscle with that hip and what it does. The gluteus medius, okay? So we have 3 gluteus muscles. We have your gluteus maximus, you have your gluteus medius, and your gluteus minimus. The gluteus medius muscle is a muscle that actually abducts the leg, okay? Also, the other thing it does is when you lift the opposite leg, it contracts to hold the pelvis in place. So when that doesn't occur, or if you have a hard time doing that when you lift the leg, what happens is you'll notice that this hip hikes up and the knee kind of shoots inward, almost like a knock-knee position. So this kind of thing happens. We know when that occurs, there's some sort of deficit and weakness going on with that gluteus medius, which could be causing extra stress and undue pain on that knee because of those torsions occurring. With that also, you'll notice also too when people are walking and they're really favoring their one leg, now definitely that, and they're limping, that definitely could be some knee issues itself. But I'm talking about the ones also when they walk that they transfer their center of gravity over their leg. So when they're walking, they kind of do this. And they basically have to move their center of gravity to that side, or even worse, they're kind of walking like a penguin because they have to do this, because both gluteus mediuses are weak, okay, versus having that center of gravity more in line where you're basically just walking straight. So when patients are in the office, we'll do an exam, we'll assess those things, putting them through certain movements and certain leg lifts and whatnot, and see what's going on. With the ankle now on the opposite side of the knee, we want to see how that ankle and how the foot works, and specifically the arch of the foot. Now we want to have an arch to that foot, but at the same time we need that foot to what we call pronate or flatten out. That is going to help as a shock absorber while you're walking. So when you walk and you hit your foot, or your heel I should say, to the ground, what happens as soon as you hit that foot flat is that arch should fall. That's going to act like a shock absorber. But if there's too much of a flat foot, or what we call hyperpronation, it's really hard and very inefficient to walk. So what should happen is, as we walk and we hit, and that foot flattens out, when we transfer our weight over top of that foot, that arch should start to come back. You should start to create that arch, because then what happens is the foot gets really rigid. So that gives you that propulsion to push yourself and toe off. When there's too much of an arch, too much of a flat foot, and the foot is hyperpronated, it never creates that rigidity that the foot needs. So again, we might need to look at the foot to see how the mechanics of the foot are working. And a lot of times what happens is when there's so much what we call hyperpronation, again, that's a flat foot, this shin bone here, I'm going to bring it up here. So this shin bone here, what happens is, if there's too much of too much of a flat foot, this rotates inward. And when it rotates inward, it causes this foot to be flat. That puts a lot of stress on the knee, and then conversely, this femur bone also internally rotates. And when it internally rotates, you'll actually just see, basically the crease of my pants goes inwards, and that puts a lot of, again, undue stress on the knee, and it causes a chain reaction all the way up to the hip and most certainly the lower back. So those are some of the things that can happen. Unfortunately, like I said, it's not just the knee that is the problem when there's knee pain. You need to look at the hip and leg, and ankle. So if there's anyone that you know, maybe yourself included, that's having some knee issues, by all means give us a call. We can definitely take a look at you. Sorry about the length of this one. It took a little bit longer, but hopefully the information was good. Thanks a lot, and take care, and thanks for listening. Bye-bye.